Flo at Flow Strength, and today we're gonna have a chat with Isaac the Chiro. That's just his Instagram handle if you want to check it out. But Isaac, introduce yourself.
Mate, thanks for having me. So my name's Isaac. I'm a chiropractor just down the road at DMC Health and Wellness. So a little chiropractic practice down there. I'm also a PhD student at Macquarie University, where I'm studying, looking at integrating chiropractors and physiotherapists into GP practices for people with low back pain. I'm also a tutor and lecturer at Macquarie University in the chiropractic department. And outside of that, I do a lot of sport. I compete in Olympic weightlifting and very casual hobbyist at jiu-jitsu as well.
Wait, so you do all of that and then you still have time?
I try to get enough time. Not much time.
Yeah, so let's go a little bit on your athletic background, because I think like you got quite some a cool background and good achievements. So you were mostly competing in Olympic weightlifting?
Correct, yeah.
At a national level?
National level, yeah. So I found weightlifting through CrossFit. So I think I was probably like 16, 17. I was doing a bit of strength training. Like I was working in a commercial gym, and like one of my mates was a PT, and he was kind of getting me into starting that like more strength training. So heavy back squats, deadlifts, all this sorts of stuff. Because before I was just doing kind of bro sessions, like typical 16-year-old with a string singlet, like smashing bicep curls.
Yeah.
And he started getting me into strength training, and then I kind of found CrossFit through that as well. So enjoyed like the gymnastics aspect to it. But then I kind of really fell in love with the Olympic weightlifting side. I didn't really enjoy the doing it under high intensity. I really wanted to focus on my technique. So I ended up at that time I was kind of just finishing high school and then moving to Wollongong to study at university. And at the time I just kind of found a gym there where I could start learning Olympic weightlifting. So a lot of it was just self-taught, just from watching YouTube videos and kind of following different weightlifters. From there I found a coach. So my first coach was in Sydney. So I used to travel up to Sydney from Wollongong like once or twice a week to train with him. And then started to get interested in competing from there. So I spent probably 3 or 4, probably closer to 5 years actually, training with him and then competing at a state and national level. After that point, my coach ended up moving away, so I actually stopped training for a few years and then eventually came back to it in the last couple of years once I've actually finished my degree and had a bit more time and kind of fell in love with it again. So realistically it's been a 10-year period since I started weightlifting, and then a few years gap in between that. But yeah, competing up to a national level. I competed at nationals last year, where I got second place in my 73 kilo category. I snatched 117 and I clean and jerked 140 and got beaten on the last lift, unfortunately, but that's all right.
What's the body weight there?
Under 73 kilos.
Yeah, I think that's the really impressive part, right?
Yeah, so that was, and I've hit slightly bigger in training, which is pretty typical. I snatched 120 at about 74, 75 kilos body weight and clean and jerked 142. Yeah, so that's my main athletic background with Olympic weightlifting. Since I've kind of started working as a chiropractor and been very busy with uni, doing a PhD, like I didn't really have enough time to kind of dedicate to weightlifting specifically. So I've actually kind of just backed off a little bit and just kind of do some general strength training here or there just to stay fit and strong. But I've picked up jiu-jitsu as more of a bit of a hobby and something that I can just enjoy a bit more, as opposed to training really hard dedicated to weightlifting. Just because as you get a bit older, your outcomes and your goals sort of change, or what you want to do. So I think I've just kind of pivoted that just as something I can just enjoy a bit more and do a bit more casually, just to stay fit and active and learn something new.
How has it transitioned from Olympic weightlifting, which is a pretty individual sport? I would go ahead and assume that your training was probably a lot on your own.
In Olympic weightlifting?
Yeah.
We had a team.
Oh, that's great.
Yeah, so I think especially for individual sports like that, it's really important still to have a team environment, because it is a very isolating and lonely sport. You need to have the team environment. I find it really hard to push yourself by training by yourself. I think all my best sessions would be in a team environment, and you need to have a coach there watching all the time that's keeping you on track and pushing you hard. Because some people might be able to do it, but I'm personally I can't push myself to that level when I'm just in the gym by myself, it just, not the best environment for that.
Yeah, I agree. I trained for many years just mostly on my own.
Yeah.
And it gets tiring and old really quick, right?
Exactly.
Like motivation, push, and you get tired of it. I feel like it just required so much energy out of me just to get the training done. Training with people is so important. And that's where I was going with the jiu-jitsu, because you train as a group, and that's a very big.
Yeah, 100%. Well, obviously you can't really do jiu-jitsu by yourself, so it's always involved with someone else. And it's the same for weightlifting, jiu-jitsu. No matter what sport you're doing or what physical activity, it's the environment that matters the most, I think. And it's what it's got to keep you consistent, keeps you accountable. It helps you enjoy it. If you're not in a good environment, you're not going to enjoy your exercise or your physical activity. Same for people coming in here. They've got to enjoy the environment. They've got to enjoy you as a coach. I think that's the number one thing to really kind of hone in on, is finding a good environment and a good community to train with. It doesn't really matter what the exercise is at the end of the day. That's my biggest key thing for that.
I agree with that. Yeah. For me, training is super social. I love the social aspect of it.
Exactly.
Cool. Now, let's go back just a little bit. You said that you started training when you were 16. Yep. Do you remember why you started in particular?
I think my dad was always at the gym. I remember him bringing me into the gym when I was 9, 10, 11. I remember because grew up in a fairly small town, and it was one main gym, and everyone kind of knew the gym owner. He's like, oh, can I bring in my son just to kind of show him around a little bit? And he's like, yeah, he's all right. So I was kind of always exposed to kind of weightlifting and strength training at a younger age, which I think was really beneficial for me. But as soon as I kind of turned 15 or 16, whatever the limit was that you could actually go into the gym and do your own free weight section, I think I was in there. I even tried to get a job in there as soon as I could, teaching at the front desk, just doing reception, teaching body pump classes. I was doing that when I was 16. So I've always kind of been around the gym environment, which I think has been really beneficial for me. And outside of that as well, doing a lot of different team sports growing up, cricket, soccer, did springboard diving for a little bit. So I've tried a lot of different things, which I also think is really beneficial for people to try lots of different skills. And
I agree with that. I played 10 years of European handball, not the everyone asked me about that. No, at a national level, and so I really pushed there. I really wanted to become a professional, but fortunately I'm not built for it. A bit short, so not so good. But I love that team aspect and all the values, but also skills that I learned there. I think are really important. Although we are professionals in terms of more the physical aspects. I think it's important for people to get exposed to those things.
100%.
Let's go a little bit over, I think, a few questions that can be really interesting for the people that are going to watch this video. It's, you're a chiro. Let's go over just why did you want to do that first?
Yeah, good question. So this is actually kind of comes back to weightlifting. So when I moved, I started an exercise science degree at Wollongong, and I was kind of traveling up to Sydney a couple times a week to train with my coach. And I just wasn't really enjoying my degree at the time. I didn't really know what I wanted to do. Didn't really have that much of a prospect of a job after it. I was like, I don't know what I want to do. And the only thing I was really committed to and interested in was weightlifting. So I was like, I'm just going to move to Sydney to train with my coach. And then obviously I'm not completely done that I won't have any sort of backup plan. So I was like, all right, I better go do something at the same time. I better study, do something with my life as well. And Macquarie was the closest university to where I wanted to train. So I was like, just look through what they've got. And I'm like, oh, chiro. So it's no amazing sort of story, but I had a lot of good experiences with chiropractors for my own injuries when I was a bit younger, starting CrossFit and weightlifting. I had a really good couple chiropractors that I had good experiences with, and that kind of just triggered that. I was like, oh, that's interesting to me. I'm interested in the body, interested in injury, rehab, all that sort of thing. So it was a bit more out of convenience, more than anything, to be honest. Like, and there was nothing that really drew me to kind of chiro versus physio and anything like that. Like, I didn't really have much of a perception of, what are the differences, if there are any, or, I just kind of, I had good experiences with chiropractors, and that was what kind of led me to it.
Cool. Well, that will definitely lead me towards the next thing, right?
Yeah.
What are the main differences between a physio and a chiropractor?
Yeah.
Because I think a lot of people, myself included, are a little bit confused and maybe not really informed, actually.
Yeah, it's the golden question, because it's you ask the same question to 10 different people or 10 different professions, you'll get many different responses, and it's really frustrating for patients as well, because when you go to a physio, you go to chiro, you might get a different experience, and that's the thing. There's so much variation within the professions, between different practitioners, that it's hard to say this is what a chiropractor does, this is what a physio does. They blend, unfortunately, which is it's good and it's bad. So it's bad from a societal perspective, where they don't necessarily know what they're going to get when they go to see a chiropractor or a physiotherapist. If you were to put a stereotype on it, like one of the things that people perceive chiropractors to do would be, they generally work with the back, they'll generally perform spinal manipulation or an adjustment, they'll crack your back, they may not give you many exercises, they might be concerned about your posture or your desk setup or things like that, or they might want you to keep coming back to you forever. These are some of the kind of societal perceptions or stereotypes of what a chiropractor is, versus a physio, which might put you on a ultrasound machine and leave you for a while. They might give you a bit of a massage, or they might just give you exercises, or give you some TheraBands or whatever it might be, and they'll just kind of let you go. I think that's some of the stereotypical stuff, but from my perspective, from studying at Macquarie, like, we had a really good program, a really good evidence-based program, and I had a good close friend at the same time doing physio at Macquarie as well. So I had a really good perspective of what we were both being taught at the same time. From my perspective, we were both getting really good. In fact, I think the chiropractors were getting even more evidence and study on musculoskeletal conditions, so back pain, neck pain, headaches, every other joint condition. We were getting more information, I think, about diagnosis, management, and rehabilitation of these conditions. Whereas the physios, they got a bit of that, a bit more surface level, but not as much in-depth knowledge, but they got a lot more breadth in different aspects. So in Australia, physios can work in public settings, so work in the hospitals, so they get experience with working with like post-stroke patients, more post-operative stuff, hip and knee replacements, working with neurological conditions, more of that kind of really intense rehabilitation side of it, whereas we don't get any exposure to that. But we're great with dealing with everyday run-of-the-mill, musculoskeletal conditions, and I think we get a better differential diagnosis and management for those conditions. But anything more in the public system or post-operative, physios are better trained at that sort of thing. But not to say that we can't, and not to say that physios can't just manage normal back pain, neck pain. There's so much variation within it. It's so frustrating to tell patients that. But that kind of always leads me to the same kind of question or thing that I tell patients when they're asking, should I see this physio or should I see this chiro? Like, if my family member was asking me, like, they live out of Sydney, like, who should I go see? I would often just try and say, you've got to find someone that you can connect with, someone that's going to listen to you, someone that you can trust beyond that, and someone that's not trying to sell you a fantasy or a miracle cure, essentially. Someone that's reasonable, someone that's evidence-based, they're well-trained. Their professional title realistically doesn't matter that much, in my opinion. I try not to hang on the fact that I'm a chiropractor. If people want to call me a physio or an osteo, whatever it might be, it doesn't really matter. I think the biggest thing is, can you connect with your patients? Can you listen to their concerns? Can you identify their goals, what they actually want to do? And can you help them get back to that point or back to whatever they want to do, or get them out of the pain situation that they're in? That's the main thing. The professional titles don't mean that much, in my opinion. It's just the way that you can get access to helping these people. It's not necessarily a be all and end all.
Yeah, I agree with you. That part with like, can you connect with that person? Like, is so important and so underrated. But really, it's like, hey, do you like that person?
100%.
Because, well, that will facilitate the way you work together. It's a relationship in the end.
Yeah.
Not a loving relationship.
No.
But it is a relationship, and the better that relationship can be, the most likely better the outcome.
Realistically, yeah. In my opinion, that's the biggest thing that will predict a good outcome is one of the biggest, how well you can connect with your clinician and vice versa, and how much trust you can have in that process. Because there's nothing worse than going to see someone and you're not really clicking with them, or you don't trust their advice. You're not going to commit to what they're going to tell you, and then you're not going to get a good outcome. They might be telling you really great stuff. They might be, going on, what's the best evidence for this condition. But if you're not going to do it, or if you don't trust them, you don't have a good relationship with them, you're not going to do it, and then you're not going to get a good outcome.
You're not going to be bought in.
Exactly.
Onto the solution.
Exactly. Yeah. They need a buy-in.
And the process. Yeah.
Yeah.
Yeah. I think that's a really big part. But personally, and I think you can speak to that. But there is another big part for me on picking who I want to work with, is they need to themselves exercise and look after their health. I cannot step into someone's office and see that they're not looking after their health, or they don't expose themselves to any type of training or sports.
Yep.
I personally feel like we're not going to be aligned in the solution that we're going to try and move forward with.
Yeah. So what I'm hearing is that's like that it's a reflection of their own, kind of motivations and skills, and kind of being able to put that knowledge into practice. Is that what you mean? That's a reflection of who they are, or?
For me, it's the fact that our values kind of need to align.
Yep.
And I mean, not on everything. We don't need to agree on all things in life, right?
Yeah.
But if I see that they exercise, then they understand how important it is for me to get back to moving. And they will also promote moving instead of, there's so many bad health professionals who just say, well, your shoulder hurts, we're going to rest for 6 weeks.
Yeah.
Yeah, it's not hurting in 6 weeks anymore. We haven't fixed anything. We just don't have the symptom anymore.
Yep.
And that is really not helping anyone. And so I want to make sure that I do not get that approach. If I have someone like you who's training, you are going to be also very knowledgeable in what type of exercise I can do, type of exercise I should avoid. You're going to understand what I'm talking about. We're going to have a common language.
Yeah.
And you would understand my needs probably a lot better.
Exactly, yeah.
And so the process to get me back to what I want to be doing, or get back to pain-free, whatever that is, I would be more bought in, and I think the outcome would be better.
It's as simple as they understand the experience that you're going through. So in my perspective, when I was a weightlifter and I had an injury, I needed to go find someone that first just understood what weightlifting was to start with. Like that can be such a hard thing with athletes or people that just do kind of sort of functional activities. You go to a clinician and they don't understand what a snatch is, what's a clean and jerk. You could say that for any kind of more niche sport. People just don't know what they are. So then, because they don't know what they are, they don't understand what it takes to get to that point. What are the necessities for their mobility, their strength, their coordination? What are the properties that they need to have? And they don't understand how to rehabilitate it either. You can get a general idea and you can still get good results without fully knowing the sport, but it always helps to have someone that has an in-depth knowledge with what you're trying to achieve, or what you're doing to try and achieve something. It's like someone that's like a professional basketball player coming to me. Like, I know what basketball is. I know kind of what the skill is involved and how the sport works, but like, do I have the in-depth knowledge to help someone, like a professional athlete, get to a point where they can get back to pain-free? Maybe, but there's probably going to be a lot of other clinicians that can do that better than I can. Not saying you can't help those people, but if you really want the good result, you really kind of need someone that understands exactly what you're going through. That's really important for sport specifically, and that can also be useful for patients, like for example with specific conditions like chronic pain. People with chronic pain can be quite stigmatized within the kind of health professional or the medical field. They feel like people don't understand their pain. They feel like they're not being listened to, or they're being kind of shunned, or they're not believed. That can be a really hard thing for people with chronic pain to go through. They go to a clinician that doesn't listen to them, or they don't feel like they're listening to their real complaints, and that can't really process that with them and help them get back onto a path. So that can be a really hard thing for patients with conditions like chronic pain. I think that's kind of we went off on a bit of a tangent there. I'm trying to.
That's all right. Cool. So now the person has picked a chiropractor or practitioner. Are there any questions that they could ask or things that they could look at to kind of get a good judgment of like who they should pick if they have a few different people that they're considering?
Yeah. That's it.
Because I think it's very valuable even before they show up.
Yeah, I was going to say even before.
Yeah.
Just I think word of mouth is still one of the best ways of getting good information, especially if you're already in a community that has sort of good relationships with clinicians that are already in the area. For example, like in my weightlifting gym, there was a few of us that saw the same chiropractor. I go to a jiu-jitsu gym where I'm a chiropractor in that gym, so I'm there to help people because they're like, oh, Isaac's here to train, but like I've got this kind of hip injury at the same time. Like I'll ask him because he's already here doing everything. Like he understands what we're doing. So I think if you're in a situation, you're in a community or you're in a gym, asking the people around you, do you recommend anyone? Who have you seen? What were they like? Was it a good experience? Did you get along with them? And then just kind of going off that. Then you can go onto their website, you get a bit of a feel, most people have a bit of an about me page. I think instinctually you'll get a bit of a feel just by, looking at their photo or, reading about their blurb. If you can go on their social media, I think nowadays that's a really good way of finding out.
Lots of health professionals do not have social media still.
Yeah. I think it's a really valuable thing. That's how I kind of approach social media is, I want to be on there to show prospective patients my personality, what I can do for them. I think it's way better than any website can do. I think it can really convey what you do, who you help, and how you do it really simply to a patient. And they're going to be able to connect with you even before you go and see them. I think that's really valuable if they are on social media. If not, if you've picked someone, you've gone there, I think during the initial consultation, if you feel like they're listening to you properly, they're just trying to understand what it is you're here for, what's your complaint, and trying to get down to your goals as well. So if they ask you about your goals, that's a really good thing. What are you actually trying to get back to? And so there's a clear path. They're not just trying to get you in, give you a treatment, out the door, see you next week. That's a bit of a red flag approach in my opinion.
Yeah, see you next week or see you in 2 days.
Yeah, sometimes.
We're going to talk about that too.
Yeah, we'll definitely get to that. But yeah, as long as you feel like they're listening to you, you're connecting well, and you don't feel just like just another patient as well. You want to feel a good connection, and they're getting you, they understand why you're there, and they have the tools, and they've at least outlined, we're going to get you back to doing this. And as long as that sits well with you, I think you're in a good place. There's obviously a lot of nuance around the specific treatments they might use or the specific approaches, but probably not worth getting into the nitty-gritties of that maybe, because that's a big minefield there sometimes. But I think, if you can firstly ask people around you in your community, get some good recommendations, look them up online or look them up on social media. And then once you get in there, are they asking about your life, specifically asking about your goals, what you want to get able to get back to, and then ask them as well, how long do you think this is going to take? And if they can give you a realistic outline of that as well, that's always really important. How is what we're doing in the treatment room actually going to get me back to doing the things that I want? That's a really important question they can ask as well. And probably the biggest one as well for people training the gym is, what can I be doing outside of the gym to help me get better? Or what do I need to avoid, or what can I do more of? how should I approach my training during these kind of painful events.
Yeah, and how can I train around
Yes.
that injury or whatever is going on at the moment?
Yeah, and they give you that option as well. So another big red flag is they're saying, oh, just stop doing exactly what you're doing. Like, that was one of my first experiences. Like after I started CrossFit, I had like a back injury. I had like a little bit of disc pain, so I was like starting to refer down my leg, and it's a really scary thing because I didn't really understand what that was. I was like 17, and I went to a local physio that a few people had recommended. He was like a pretty well-known physio in the area, and he didn't understand what CrossFit was, and I just showed him how I was squatting. He's like, oh, just don't squat below parallel. Just go to 90 degrees and that's it. I was like, well, that's part of CrossFit. Like I have to kind of squat deep. Like it's a deep squat. Like what am I supposed to do? And he kind of just didn't really have an answer for that.
And why should you avoid that?
Because it was just going to make my back worse, and it was going to lead to a disc herniation or something like that, or be bad for my knees as well. And then just didn't really give me any other path to get back to doing that, because he was like, oh, just stop doing it. It's just going to make it worse.
Yeah, just
cut
it out.
Yeah, exactly. And like that led me feeling like quite scared, because I was like, oh, I'm going to hurt my back even more if I keep going with this. Luckily, I was able to find another physio that was a lot more well-informed, and he wasn't worried at all. He's like, oh, no, that's fine. Looks good. And that was so reassuring for me, just to have a clinician, someone with authority going, no, that's fine. You can just do these things, work on these exercises, do these stretches, whatever it might be. But yeah, not someone that's just going to go, just stop doing it. Like, simple.
Yeah, that really annoys me when I hear that from health professional that should be more informed. And that's also one of the reasons why I want someone who is actually training, is because they understand that that's not realistic. I mean, any physio or health professional who tells you, well, you shouldn't squat all the way down and you shouldn't push your knees past your toes, I mean, they have clearly not trained, or they have clearly not played any sports, because if you play sports, you will get into those positions. And so it's like, it just does not make sense. So that's a big annoying thing for me. And then when they just say like, oh, stop doing that, that approach means that slowly we're going to cut out everything, right? Like, where do we stop? If we keep cutting things out, soon we'll be like, Isaac, it is better if you stay seated all day. Like, okay.
It's going to get to that point.
How is that going to affect your mental health? Like, I mean, but that gets back to the point of like connecting and understanding each other with your practitioner.
100%. So I think that point around like just stopping doing everything, there's definitely situations where you need to rest for a period of time. Especially like I deal with a few CrossFitters and kind of weightlifters and stuff in practice, and they're usually the type of people that want to keep going. But there's definitely needs to be a pullback for some people. But okay, no, you've actually done you've got a significant injury here. You actually need to stop doing X, Y, Z. You might still be able to do A, B, C, but you need to pull back on these other things that are going to make it worse and potentially prolong your injury. So there's definitely times where you need to stop training.
For sure. It always happens,
but like,
right?
Especially like acute injuries that you've done a bad like ACL or whatever it might be, or a fracture. Obviously you need to rest, but like that kind of gets into the argument of, or the conversation around, what is your actual injury? Because I'm sure you'll get people that come in and like, oh, I've done this or I've done that. I'm like, they haven't necessarily had a diagnosis. They haven't had anyone actually check it out to understand, what is it actually? Because you might just use Dr. Google and have a look. Oh, I've done this, this, or this, or this, and then they come see you and they're, oh, I can't do these exercises. But if they haven't actually had it checked out and had a good recommendation on these are the things you should avoid, well, they're kind of just guessing as well.
I think a lot of people would be interested in that. Are there any injuries that prevent you from doing burpees? I think there'll be a lot of takers.
I'm going to say no.
That can lead us on to the next question, and that's actually funny because we trained together and you had a little bit of a niggle when we did that. So what are your views and what should people do? Should they train around an injury?
Very, very important question. It's obviously going to depend on what it is you're actually dealing with, what the injury is. It's got to depend on your level of experience as well. So obviously I've been training for such a long period of time that I know my body pretty well. I know what an actual injury feels like and what is more just a little bit of a uncomfortable sensation or a bit of a niggle. I know what I can potentially work through. But for me, on that day, I'd just kind of flared my back up a little bit at jiu-jitsu, and I'd come in, a couple of days before, I was like struggling to walk, to be honest. I was struggling to bend over. I had no like forward flexion, and then I came in, I felt a little bit better on that day. I'm like, okay, I'm gonna find what are the movements that I can do, still with a level of comfort. I'm happy to feel a little bit of pain or discomfort on those movements. I usually encourage people to use like a traffic light system to help them kind of gauge how much pain they're in. Obviously, pain is a subjective feeling that's going to be different from person to person. But if you think about a red, orange, and green light, so green light being pain that's between 0 and about 3 to 4 out of 10. If you were to think 0 being no pain, 10 being the worst pain you can imagine, a green light is 0 to 3. So anything in that kind of green light zone is still a safe space. So you're still okay to do movements, do exercises, whatever it might be, as long as you're sitting in that green zone. A little bit of discomfort is okay, but if you start pushing the orange light, that's like kind of 4 to 6 or kind of 5 to 6 out of 10. That's when you start to modify. So you might change how much weight you're doing, you might change the range of motion, you might change the intensity, you might do less sets, whatever it might be. That's when you start to peel back just a little bit, but you don't have to stop it completely. The pain is not necessarily a sign of damage, it's more just like a bit of a sign that there's sensitivity in the area and it just needs a little bit less load. But then if it starts to get into the red zone, which is like 7 plus out of 10, that's like quite excruciating pain. That's when you should probably stop and exercise.
Yeah.
You're not getting you're not getting anything out of that workout by pushing through an excruciating amount of pain. But I think the main thing is most people that are in that green zone and they feel a little bit of discomfort, they're scared to push through it because they're worried it's actually going to lead to more pain, which is obviously a valid concern. And I still feel that as well. Like I'll get a sharp pain. I'm like, oh, what is that? Like, but so even me with like a lot of education around pain, like it's still a scary experience to be injured and have pain. Yeah. But just knowing that you are safe and you can kind of reassure yourself that a little bit of pain is okay to push through. A good kind of advice there as well is obviously letting your coaches know what you can and can't do and help them to modify their exercises throughout the session. If you've got coaches, to make sure that you're still able to come in, do something at least, move in a way that's still comfortable for you and still feel like you're doing something while you're not aggravating the pain or the injury as well. Yeah, I think those are the key points for there. It's obviously going to depend very much on what the injury was, like I said.
Of course, yeah, it always depends,
yeah.
right? It's not a blanket approach.
Yeah.
That would be so wrong.
Exactly, yeah. And on that day, like I felt a little bit kind of wary of my back kind of warming up, but then once I got started, I was fine. A little bit of pain towards the end range, and then a good indication is how you feel the next day as well, the couple of days after. Sometimes you'll feel really good during a session, then you wake up the next day, you're like, oh, I've actually kind of pushed it too much. So That's when you know that, you might have to just push or like drop the intensity back a little bit, knowing that you might be a bit sore the next day as well. But that's also okay. Like it's a lot of people get scared just having DOMs for the first time. They've actually started to use their back a bit more, like they're doing heavy lifts like this. When you first start doing deadlifts and squats, the people that haven't done them before, it can be a bit of a weird sensation to feel like DOMs in your back. They're worried about, have I injured something, where they're just feeling muscle soreness because they're using their back.
Yes.
Yeah.
Good. We can segue onto that. A lot of people often get very scared, worried about feeling the muscles in their back. But we do need to strengthen there too, right?
Yep.
How can people approach this and understand that it is okay?
Yep.
Like, do you have any tips on like what is okay to feel? What should maybe actually worry someone or stop them from doing a movement, or give them a little hint that maybe they're not doing this right?
Yep.
Do you have any recommendation on that?
Yeah, absolutely. It's a funny sort of conundrum where people will like they'll smash out some bicep curls. They're like, oh, I love getting a bicep pump.
And it
like,
hurts. It's fine.
Yeah, it feels great.
Completely
but then
okay.
As soon as it comes to the low back, everyone's like, oh no, I can't. You can't feel the low back. It's an odd odd thing.
Yeah.
But it's okay to feel like a pump in your low back. It's okay to actually use it because that's how you're going to make it stronger. It's a bit of like a self-fulfilling prophecy, because if you're not using your back, and you're trying to avoid moving it, you avoid strengthening it because you're worried about you trying to use your legs more, your quads, your glutes, whatever it might be, and you're not actually isolating the back or not training the back, it's going to make it weaker and then therefore make it more susceptible to injury. So people don't train their back, get injured, and like, oh, it's because I must have been using my back too much, and then they train even less, and it's just like this cycle that goes on. If they were to actually train their back like they did any other muscle and not be scared of getting a back pump or actually training the back directly, they'll generally become more resilient to it, get stronger, and actually have less injuries over time.
Yeah.
So it's a bit of a self-fulfilling prophecy in that way.
Definitely.
But obviously there is things that you should keep an eye out from and try to avoid. Obviously, a normal pump is a normal feeling to have for the low back, like you would anything, especially if you're doing something heavy like deadlifts. But if you're starting to feel pain that kind of starts shooting down the leg, a lot of people are concerned about sciatica. That's a bit of a misconception, or people have a lot of misconceptions about what sciatica is. So a lot of people will feel pain in the back and like, oh, like I've got sciatica. Sciatica is specifically when we have generally like a disc herniation from the lower disc in the spine, compressing the nerve root that exits. So the nerves that come down, so the largest one being the sciatic nerve, that all come down back of your leg and control all the muscles, sensation and everything all the way down to the leg. So a episode of sciatica, we also call it a lumbar radiculopathy. So that's when something like a disc herniation compresses the nerve, it sends the pain, so you'll get generally a referral pain shooting down the leg. So it might feel electric sensation or a shooting sensation that might go down the leg. Generally, if it goes past the knee, that's sciatica.
It's a good sign.
Yeah, no, not a good sign. Yeah.
If
it stays above the knee, it's a better sign. But if it's, when patients come in, they're like, oh, it's shooting all the way down to my calf and into my foot, that's a bit of a worse sign. And that can get to the point where they start to get muscle loss of muscle strength in those muscles of the feet or the legs, and they start to feel numbness, tingling sensations. That's when we know that there's a bit more compression or irritation to the nerve. So if they're still feeling those types of sensations in the gym, that's when they probably need to stop, especially if it comes on really suddenly like that. Often you'll hear people that they go to pull on a deadlift and then they get this big shooting pain down the legs. That's a bit of a common thing I've heard of from patients. So that's at a point where you should probably stop. Yeah.
I think the red light is quite on at that point.
Yes, exactly. Yeah, exactly. Bring it back to the traffic lights. Yeah, the red light is definitely on, and
it should be pretty clear then.
Yes, I think so. Yeah. But besides that, if you're just feeling a bit of a pump, you feel like you've actually used your back, it's a good thing.
Yeah, I think there's a big difference between muscle as well or nerve pain.
Yeah, absolutely.
I guess some people who haven't been exposed to as much training might not quite be aware of the difference and what it feels like.
Yep.
That does come maybe with a little bit more experience.
100%. Yeah.
But generally, when you're a little bit more advanced, you are able to tell the difference.
100%. Yeah. And unfortunately, it is a bit of trial by experience as well. Like, thinking back on my training when I was younger, like obviously pushing pretty hard, but also scared about injuries. Like I might have been too conservative in some points where I probably could have pushed through a period of discomfort, but I stopped because I was worried about hurting myself. And then on the other side, I could have also cut back a little bit more when I felt like a pain or a niggle come up that I probably should have listened to a bit more. So there is a bit of trial and error and like that bit of an intuitive feeling. If you're doing an exercise and you don't feel confident doing it, you don't feel like you're able to do it, there's a bit of psychology in that as well. But if you're not feeling confident, that's probably a good sign to kind of cut the weight back, for example. So avoiding doing big jumps in weights that you're not prepared for, you haven't done before. I think people first get into the gym are a bit maybe they can be a bit over enthusiastic about how much they kind of improve quickly, because everyone kind of gets the newbie gains, so they want to kind of keep pushing the weights and hit PBs every week. But learning to slow that progress down so you're not creating these big spikes in training, because that's one of the kind of main reasons people get injured is they're just doing too much too soon, and it's an overload on their system essentially. They're not ready to handle that much volume, that much intensity, that much weight, and the body can't handle it, so it kind of leads to an injury.
We're talking about back, so I have a few questions on that with you. Should people be worried about flexing, extending, or twisting their spine, right? Because there's a lot of, I don't know, this weird
fear-mongering.
Yeah, fear-mongering, and some professionals like really kind of like share that message and scare people a little bit about that. So what are your recommendations?
Yeah,
Although, I kind of know what's going to come.
Yeah, I think because there's a bit of a bit of a stereotype or a general consensus that flexing your back too much, especially under load, can be dangerous, which I don't think is true 100%. There's definitely cases where you want to avoid that a bit more, especially for someone that's quite new to the gym, that can, or they haven't been exposed to these positions before. There is an argument to say that if you haven't done much training or you haven't spent time in these positions, you'll be more susceptible to injury, for example. But for pretty fit, active people, slowly building into those positions will be fine. Like, you're not going to damage yourself just by flexing your spine. You've got to flex your spine all day, every day. People, you spend half your day in like spinal flexion. Like, I'm sitting here hunched over a little bit, my low back's in spinal flexion. When you go into a squat, your back naturally flexes at the bottom. Most people, when they're set up for a deadlift, they're not in a truly neutral position. If you were to actually look at their spine, there is naturally going to be some flexion in the lumbar spine. You can't avoid spinal flexion. So because you can't avoid it, you need to train it. You need to be prepared. You need to be exposed to those positions, but in a safe environment that's had good programming and not making big jumps or anything like that. Anything, the slow progression into these exercises is the key there. It's the dosage. Same with if you're doing a lot of hyperextensions or something like that. Like, if you're doing 1,000 reps of hyperextensions, no matter how good of an exercise they are, you're going to probably irritate your facet joints and your low back because you're doing so much of it. Like, any exercise can be a bad exercise if you do it wrong, or you do it too much, or do it too much weight.
Exactly. I don't think there's bad exercises. I think there's they're just tools, and sometimes people use the tools.
Bad application.
Bad application. I think is a good way to put it.
Yeah, exactly. No such thing as a bad exercise.
Exactly. And then, so people shouldn't be afraid. They should slowly progress those exercises. Why do you think, like, people most of the time, they don't hurt themselves at the gym? They're like, I bend over, picked up like my pen or a handbag, and I was twisted and reaching forward, and I blocked my back.
Yep. Yeah, very, like, why do you think that happens? Is that...
Yeah. What, why, and also how can they prevent that?
Yep, absolutely. So that's, it's a very common thing for people to come in. Like, even people that are very fit and active, and they'll be like, oh, I bent over to pick up my kid or something like that. Or I've done this pretty insignificant activity, or picked up a pen or whatever it might be, and all of a sudden my back's just kind of flared up like that. There's not one clear answer, but I think the best way to kind of give a general overview of that is something called the bucket theory. So if you imagine yourself, you are a bucket, and the water that you fill that bucket up with is all the different stresses, influences of your life. So every bit of exercise you do, your work, your kind of home life, your stress, all these things are like filling your bucket up, and how big that bucket is like your capacity to handle them as well. So if you've got a big bucket because you're quite fit and strong, you're pretty low on your stress, or you've got a managing stress at least, you've got to have a bigger bucket. So, but if you don't have those things, for example, if you're not very fit, you're not very healthy, you don't sleep much, you're gonna have a smaller bucket, and when those things start adding up, they fill your bucket. When it overflows, that's when you start to get susceptible to pain or injury. That's when your muscles can't handle all the load, or the ligaments can't handle the load, and they might be injured more easily than other people. So I think it's kind of like the straw that broke the camel's back, pun intended. That people that there's usually a background of lots of different stuff going on. They might have just started at the gym, they're doing more activity than they previously had done. Maybe they've got like a big spike in their training, or maybe there's lots of other lifestyle factors that influence it, like how much they're sleeping, their nutrition, all these things that are affecting their recovery. Yeah, massive like stress, work stress, home stress, whatever it might be, or just the way they're managing that stress. All these things can kind of make your body, make your nervous system more susceptible to injury in that time. And that's why, they can have all these things add up, and then all of a sudden you bend down to pick up a pen and they go, oh, my back's gone. I think that's the nicest explanation for me to help people have a bit more of a holistic viewpoint, because it's easy to say that you bend over and you kind of just strain your muscle, like you might have strained your muscle, but what are the things that lead up to that thing? I think is a more important thing to think about, and it helps. I think it's a reassuring thing for people, because people have a hard time thinking about how the other things in their life can affect their gym and affect their body, because that's big part of my job is helping people just be more healthy in general, not just be strong and be flexible and have good mobility. I want to think about their lifestyle factors as well and how that can influence it, because someone can be great, they're going to the gym all the time, they're training really hard, but if they're not sleeping well, they're not having good nutrition, they're not managing their stress, all these sorts of things, they're not recovering, they're going to be more susceptible to injury.
Yeah. And we have to look at the person as a whole. We try and compartmentalize things, and it's like, well, when people walk in here into the gym, they don't live, whatever is going on in their life, like the pressure of the mortgage or whatever is happening at work, or their kids, and like they carry all that all the time.
Yeah, 100%.
And so we have to take that into account for sure.
It was like a big thing, obviously, during kind of COVID. I was still a student during COVID, but we started treating patients in the student clinic it was like the year after kind of COVID first hit. And just from experience of hearing people dealing with patients out in practice during COVID, like in chiropractic practices, you're seeing increases in all these kind of musculoskeletal conditions like neck pain, headaches, low back. But often the drivers of that, are stress related, they're isolation related, all these sorts of things that can influence a person's pain experience, or that make them feel more intense as well. Because if you sprain your ankle, but you haven't really got much else going on, you can deal with the sprained ankle. But if that sprained ankle comes on a time when you've got a debt hanging over your head, you've got a busy work week, or you don't have any work maybe, or you're struggling to get money together, you've got home issues or whatever it might be, that ankle feels a lot more painful. It feels a lot more intense. That situation feels more intense because of your situation or because of your environment around you. So it kind of amplifies the pain and the injury. So I think that's a really important connection I try and show my patients, is that your pain is not just in the ankle, it's not just in the back. It's like it's you as a whole person experiencing that pain. And there's lots of different things we can do to help that pain and to help you as a person.
I like it.
Yeah.
That's very good. Because we are on that spine still a little bit, what are your thoughts? Should people train with a belt, or should they avoid the belt, or when should they use the belt?
Yeah, realistically, I don't think anyone really needs a belt. In my opinion, maybe weightlifters at the top level, they might get something out of a belt, but using a belt is a bit of a skill as well. You can't just slap a belt on and it'll just help you. You need to kind of actively engage with the belt as well. I always used the belt for kind of my first 4 or 5 years of weightlifting. I thought I was getting benefit out of it, but when I actually took a few years off and I came back, I never put it back on, and I hit all my PBs, surpassed all my PBs. I don't train with a belt anymore just because I didn't feel like I needed it. I didn't feel, if anything, it was annoying me. Because I used to always use one when I clean and jerked. But now when I came back to weightlifting, I started clean and jerking again. I just didn't put it on, and I just kind of didn't feel the need to use it, because I was able to just engage my core better, I suppose, and not have to rely on these kind of outside things. Yeah, some people can definitely use them to their advantage, but Gen Pop, just people in the gym, I realistically don't think many people need the belt. I think understanding why they feel like they need the belt is an important question, because a lot of people will feel like they're protecting their back by wearing a belt. Sometimes just having something there to kind of engage with can help people. Like I'll still use knee sleeves sometimes. Like most of the time when I squat, and they're not very tight knee sleeves. They're actually not really doing that much, as far as, if anything, they just kind of keep my knees warm.
Yeah.
But it's a bit of a psychological thing, because I feel more confident, I feel stronger when I wear the knee sleeves. So I understand why people feel like they need to wear a belt.
Yep.
But I can still squat fine without the knee sleeves. It's not a limiting factor. You're generally not going to lift a whole lot more with these kind of accessories. They're not, maybe if you're at the top 1% of lifters, adding a belt and adding knee sleeves and whatever it might be will definitely help you. But for most people in the gym, I would think it's better to try and avoid those things if they can.
Yeah, I totally agree with you. Like, I think the belt is a tool, and first you have to learn how to use this tool to benefit from it. But what are the benefits? It's just about lifting more weights. You actually didn't get any stronger. You just are using this tool to your advantage to lift an extra 5, an extra 10, an extra whatever. And unless you're trying to compete, that doesn't really matter, because we're not getting you stronger by using a belt. You are just lifting more weight. So I'm always like, we're just trying to get stronger so that we can do fun things outside the gym safely. So for me, I don't really use a belt pretty much ever. I don't use anything. I train barefoot. I don't wear knee sleeves. I don't wear a belt. I don't wear anything. Because when I'm going to be outside, I mean, I'm not a dad yet, but when I'm going to be a dad and I want to pick up little Timmy, I'm not going to be like, quick, belt up, let's play,
Walk up,
Yeah, I'm going to choke. I'm not going to make sure I'm wearing the right shoes. Like, I just want to be ready to use my strength, use my fitness, right?
Yeah, you can't be reliant on these tools, because I think that's the thing where people get worried about it. Like, I think you kind of get a bit neurotic about it. You're like, oh, I need my belt. I need the perfect environment to lift. Like, it's a bit off topic, but like, I used to have a favorite bar that I'd always use at the gym, because it had the nicest knurling on it, had the nice amount of spin on the bar. I'm like, I had to have that bar specifically. Yeah. And if someone else took it, I was like, no, where's my bar? Like,
I can't train going home.
Exactly, yeah. And then if you have a bad session, you're like, oh, it's because I didn't have my good bar.
Yeah.
So obviously you want to avoid those kind of situations.
Awesome. What are the most common injury that people come and see you with?
Yeah.
Or that you see?
Yeah. So obviously, this kind of comes back to what is a chiropractor? Most people perceive chiropractors as kind of people that look at your back. So that is a pretty common stereotype. So the most common things I definitely see is back pain, low back pain, neck pain, and headaches, and then probably like mid back pain. Low back pain is definitely number one. But with that as well, it depends on the population you see. I see a bit of a mix. So I'll see some CrossFitters or some weightlifters, but I'll also see like a lot of older patients as well. They deal with a lot of back pain. But I'm more than happy to also see hip, ankle, knee, whatever it might be, wrist, shoulder. But yeah, low back's definitely the number one that I see.
What would be your recommendation as kind of like for everyone on what they could do, or what most people should do, or what are the biggest mistakes that people make that could really make a big impact on reducing their risk of injury or increasing their, enjoyment in life?
Yeah, 100%. Yeah, so I think if a patient's coming to see me and they're injured or they're worried, a lot of people come for kind of prevention as well. I think nowadays people are a bit more mindful of trying to prevent things from happening. So often I'll get patients coming in with no particular major concerns or injuries. They might have a bit of tightness or soreness, but they'll be like, oh, I just really want to prevent back pain from coming on. So with those people, which is obviously a great conversation to have, because they're not coming to you with a pain, they want to try and stop something from happening. And to an extent, you can definitely help to stop it. You can't stop all injuries happening. I think that's a bit unrealistic. But you can definitely do a lot of things to prevent back pain from happening in the future. the biggest number one thing is being physically active. So the first thing, obviously, I'll ask people is, are you currently doing any exercise or physical activity? How much? How often are you doing it? So the biggest thing for me is, are they meeting the kind of current guidelines for physical activity, whether that be the level of high intensity or low intensity they need to be doing. If they're doing that, great. What kind of exercise are they doing? Is that sufficient enough? Are they doing any kind of strength training, which I think is a major thing now, because we have a lot of guidelines around specifically doing strength training as well, especially for people that are getting older. So obviously decreasing the risk of falls, improving bone density, improving muscle mass and limiting kind of sarcopenia, so losing muscle mass over time. That's really important. But if they're not hitting any of those guidelines, they're not doing anything, my first goal is to just get them doing something.
Get them moving.
The biggest thing is approaching that conversation about, not giving them, you have to do this type of exercise. I think you don't want to put too many barriers around exercise. So you want to make it as easy as possible for the person to start exercising and do something consistently. So giving them the options that you don't have to do specific types of exercise. I want you to do something that you're going to enjoy and something that you can be consistent with, because those are going to be the two biggest kind of predicting factors of you staying fit over time and therefore likely preventing some back pain from coming on. So first of all, what's something you enjoy? Is that strength training? Is it yoga, Pilates? Is it going for a run? Whatever it might be. Some type of physical activity. And then once they're doing that, then we can start having conversations about optimizing that a bit, doing some more strength training specifically, because that is something I think everyone should be doing at least some of, to certain degrees. But if they're not even hitting the guidelines,
I think the same, obviously.
Yeah. Exactly, they all need to be coming to flow strength. That's what. But yeah, I think that is getting better. I think more people are becoming more aware of the benefits of strength training and less fear around it, because obviously a lot of stigma around women shouldn't be doing strength training, or old people can't be doing strength training, they can't be lifting weights. I think those kind of old stigmas are kind of dying off a little bit. It's still there, obviously bits and pieces, but it's becoming way more kind of popular as well, which is obviously great. People are becoming more strong and fit and healthy, and that's going to hopefully reduce some of that back pain as well, and prevent it from happening over time. Obviously the other thing I kind of remind patients is, because they're very scared of becoming injured, I'm like, I really want to hone in that you can't prevent all injuries. Some just happen randomly, and that's okay as well. You got to get injured somewhere along the path. It's fairly likely. 80% of people will experience back pain at some point in their life, and it's okay when that happens. And just being prepared for it when it happens, and having someone there to support you, and knowing what to do in that situation will get you back on the path quicker. Because a lot of people that I'll see is that they've had an episode of back pain, and then they stop doing everything, and then they just get weaker, and then they try to go back to training. They try to go too quickly or whatever it might be. They don't have a good structure around it, and then they flare it up again, and then I made it worse. I've got to stop just doing everything, and they do less and less and less and less.
It's better when I'm not training.
Exactly, yeah, exactly. It feels good when I rest, and then when I do stuff, it hurts. I'm like, well, that's because your body's gotten to a point where it's lowered its threshold for what it will consider to be painful. You've lowered that threshold to a point where you're doing any amount of activity and you're getting pain. So that's the point that we want to avoid, because then it takes such a long period of time to kind of slowly step that back up to a point where your body can tolerate these positions and tolerate this amount of exercise.
Yeah. Just to go back on what your recommendation were on finding something that you enjoy, I totally agree with that. I think people stress too much about what is the best thing I need to do. The best thing you need to do is start somewhere. Yeah. It doesn't matter where it is. Yeah. If it's start doing push-ups at home, or just going for a walk, or riding your bicycle that you haven't touched in your garage, it doesn't matter. Just start somewhere. Yeah. And then when you're consistent with it, we can figure out, all right, are there other things that can benefit you, or that could be maybe better or complement, but just start, 100%. Just move.
But that's often the hardest part, is finding, just starting. But I think then giving them options of really encouraging. This is where I really encourage, team sports or communities or gyms that have a good environment where you're not necessarily going there to exercise. The exercise and the benefits of exercise is a bit of a byproduct of having a good community and having a good space where you enjoy going to see the people at the gym. Like, that's what I feel like with jiu-jitsu. I've got a good group of mates that I can go to jiu-jitsu with and train, but I'm not necessarily going there because I really want to learn the new arm lock variation today. I'm just like, I want to go enjoy, I want to go do some exercise, learn jiu-jitsu, but I want to have a good time with my mates. I want to roll around and wrestle with my mates. Like, that's more enjoyable to me than some specific type of training. And that was the same with weightlifting, where I kind of stopped it because I didn't have a passion for it anymore. I was kind of training by myself or a very small amount of people, and like, this sucks. I'm like, what am I doing this for? And it wasn't until I kind of got back into it and found a good little gym and found a good few mates where I can train with again and get excited about it. I'm like, wow, this is mad. Like,
and compete a little bit.
Yeah.
I think it's probably a bit more important for men than women, but that like little competitive aspect, which can also become a problem sometimes.
You don't want to be too competitive,
If you're a little too competitive, mostly if you're out of shape and a little too competitive, this is how you get really hurt. Yeah. But a little bit of healthy competition can be great and really help that environment and the banters and things like that.
I think, I always tell people, like, I tell myself, I don't take it too seriously either. Like, I'm not competing for an Olympic gold medal. Like, it's all right. You don't have to be the best at everything. You don't have to learn everything straight away. A lot of people will give up on learning new skills or anything like that because they can't do it straight away, which is obviously, I think, a bad approach, because you got to enjoy the process of learning a new skill or being in a new environment. Like, when I first started jiu-jitsu, I was so bad, like everyone is, terrible at it. And like, I'm like, this is so weird to me because I'm not good at it yet. But obviously, I understand that it's a process to learn this skill over a period of time, and you got to enjoy that beginning stage where you're not too good at it. But that's why I think to find something that's good for physical activity and then has a skill component to it that you can progress at over time. So it's not just I'm getting fitter, I'm getting stronger. It's like I'm learning these new skills as well within this good environment that's going to keep people consistent over time. That's why I think some exercises can be better, because something like yoga, which is obviously a great form of exercise, it's not necessarily like building strength over time. It might be better for different populations, especially like kind of older people that can't do as much exercise. Things like yoga or Pilates are great, but there can definitely be room for more kind of structured training within that as well.
It's going to be difficult to build muscle mass. Now, I'm not bagging on yoga or Pilates. I think they are good options, but it definitely is very difficult to build significant muscle mass.
Yeah, absolutely.
With this type of activity.
Yep.
Now, this is a funny topic, but if I come and see you, Isaac, do I have to get on a treatment plan?
Yep.
Where I'll have to come maybe 2 or 3 times a week for 6 weeks? Because that's what I've experienced before with other chiros.
Yep.
And obviously I own my own business, so I understand this is a very good business plan. But as a patient, I don't think it is very good.
Yeah, it's definitely.
So run me through your thoughts and how you guys work as well, because it's very different.
Yeah, it's a very common experience of patients. It's a bit of a kind of old school way of approaching business, not necessarily just for chiropractors. There's definitely kind of other professionals that will sell these sort of treatment plans, and they'll sell it as, it's cheaper to, you pay all this up front.
Big packages.
Yeah, exactly, yeah. And to be fair, there might be situations where they've got a specific injury that will need, a dedicated amount of follow-up time. So for those sort of situations, it might be beneficial. But I think for everyday run-of-the-mill person coming in with back pain, they don't need a dedicated treatment plan like that's paid up front. Definitely not. I think we don't do treatment plans. We only pay one at a time. I think it's important to lay out to your client or to your patient at the start. It may likely take this long to kind of get the results that you want to get or to reach the goal that you want to achieve. That's completely fair, I think. But to say you need to do this amount of treatment over this period of time, and you need to come this amount of times, it's a very cookie cutter approach that it's not individualized to that patient. They might say it's individualized, but it's not really, because they're probably going to tell the next patient the same thing. But I think there's a bit of nuance in there as well, because you don't want to see someone once and just go, yep, you'll be right. You need to follow up, and it's part of that relationship building as well. But it's got to be flexible. It's got to take into account the patient's current condition, what they kind of need at that time, their own preferences. You know, most people, they're pretty busy. They don't really have time to come see you twice a week, 3 times a week, whatever it might be. Even every week, that's quite hard for some patients. And obviously the financial issue as well, obviously cost of living and everything like that. It's a massive financial burden for some people. And if you've got a chiropractor or any other professional saying, you need to come see me 3 times a week, otherwise you're not going to get better or you're not going to get the results, I think that's a very harmful type of language to use to a patient, and can really cause some damage, and can make them very scared and worried. So working with the patients, you can help them understand that a bit more care, a bit more regularly might help them a bit more in specific cases, and that's okay. But as long as you're making that decision together with the patient to understand, what are the benefits, what are the risks of the amount of treatment, what they actually need realistically, and as long as it's a shared decision, not just the practitioner saying, you need to see me this many times for this long, and it's going to cost this much. There needs to be a decision making between the patient, and they need to be involved in that.
And you're going to pay up front.
Sorry?
And you're going to pay
Yes,
up
of
front.
course, yeah. Sign the dotted line.
Yeah, cool. I wanted to cover that because that does scare people off seeing chiros.
Yeah, absolutely. Yeah.
And I've had that experience before personally, so I understand.
Yeah.
Do I need to get x-rays if I come and see you?
Excellent
Do I need to bring my x-rays if I already have some?
Yeah. Definitely bring them if you've got them.
Okay.
But most people, so a bit of background, like I did a master's of research directly after my chiro degree, and my topic was around chiropractors' use of x-ray. So I looked at understanding the reasons why chiropractors order x-ray, because it is a very common thing, and how they actually use it in their practice. Part of that I looked at what are the current guidelines, what are the reasons for taking x-ray or any imaging, what are the reasons, when is it actually going to help me in practice to make a decision about a certain patient. So I kind of found that chiropractors historically used a lot of x-ray. We're still allowed to have x-ray machines and take x-rays and report on them. We still learn how to do that. I actually teach students how to read x-rays.
That's good.
Which I think is definitely an important skill, but not everyone needs an x-ray. If anything, very few people need an x-ray. Like, I've been practicing for close to 3 years, and I've only sent for maybe a handful of x-rays in that time. And that's a very small percentage of the patients that I would have seen. There's plenty of experiences where patients have already brought in scans, and I can help them understand it and read through them and understand what it might mean. But very rarely is a patient coming to me and I really need an x-ray. So the reasons that we would want to get an x-ray straight away is that we were scared, that I was concerned about some sort of serious pathology going on with them. So if I was suspecting maybe they've got a fracture or they've got some sort of infection or something like this, like something that I can't treat, that it's going to stop them from getting the right treatment. So something serious like that, which is very rare, especially coming in to see me. That's a situation where I want to get an x-ray. Or if they've already had treatment for such a long period of time and they're not getting better or it's getting worse, that can be a reason to get some imaging.
Let's look into it.
Yeah, exactly, yeah. Because it's always good to try conservative care first. So if I treat a patient with back pain for 6 weeks and they're not getting any better, maybe I've seen them 5 or 6 times within that period, and they're not progressing like I would expect them to, they're doing all the things that I want them to do, they're not getting better, that's when I'd have a bit of a think about it again and have a discussion with, okay, maybe let's get some imaging just to see if there's anything else going on. But if you don't have that suspicion, you don't have a real reason or how it's going to impact or change your treatment, then you don't really need that x-ray at that period of time.
Do you think, now I don't like to talk negatively about other people, but do you think a lot of chiropractors ask for x-ray because of the way like makes the process looks, it makes it look more serious, like more medical, and like it makes them look also a particular way, and maybe that gets a bit more buy-in from the client. All of a sudden, things are more serious. Like we just looked at a piece of paper,
It definitely plays a major part into it. There's a couple different aspects that come into that. There's the business aspect to it of, you're potentially getting more buy-in from the patient. They're paying for an X-ray. They're bringing it back to you. You're the professional. You understand what's going on. There's a bit of power dynamic here.
The authority.
Exactly. The chiropractor is the authority, or whoever the clinician is, and they've got this expertise where they can tell you what's going on. So it definitely can play into the kind of buy-in and the business aspect to it. But it's some chiropractors use the X-rays in different ways as well. So a lot of chiropractors are very concerned about posture and spinal alignment as well. So working with people with scoliosis or excessive kyphotic changes in their spine. So some chiropractors like to get into the nitty-gritty of, your spine is slightly on this degree of angle and we want to try and change that, or something along those lines, and they'll start drawing the X-ray and showing the patient all these changes that's going on with them. Some of that can be in a way that can be fearful and kind of concerning for the patient, because they're looking at a picture of the inside of them, and it can be quite concerning. They don't really understand what that actually means. Like, is this curve, is this change in my spinal alignment something that actually needs to be changed, or is something that's going to be bad in the future? That can be a selling aspect for the chiropractors to say, look at this change in your spinal alignment. We're going to try and fix that. Let's take another X-ray later on. We're going to kind of comes into that the package deal where you'll get the X-ray to start. You'll see them for X amount of times, and then we'll make this change, and you'll be all good to go. So that is, the X-ray can play a part in that as well. There is definitely a reassuring value of imaging. So part of my research was kind of looking at, when a patient gets imaging, how can that actually be beneficial to them? So there's definitely a benefit to it sometimes. It can give the patient a sense of relief if there's nothing on the image. There's nothing really to be concerned about. There's no serious pathology. There's no kind of major degeneration or changes in their spine, for example, and they can be quite relieved by that, because patients will often go to the doctor or whoever it might be, and they go, no, we don't need a scan. But to them, they really need that image to kind of show that there's nothing wrong.
Rule out a few things sometimes, right?
And that's definitely reasonable. But if there's absolutely no indication that any of this is going on, then it's a very hard conversation to have with the patient sometimes. And I've definitely sent for imaging, just not because I wasn't suspecting anything in particular, but because they were so convinced that they needed an image, that comes into the equation. You need to kind of, and I've tried to help them understand why it may not be super beneficial. We don't really need it at this time, but at the end of the day, if they really want to get some imaging, they're probably going to get it anyway. They'll probably go to another clinician down the road. So if I can try and help them understand with that imaging, then I will still order that imaging for them, even if it doesn't necessarily meet the exact guidelines. So it's the patient's kind of decision at the end of the day as well. I think that's the main things that come into it. But it can also open just up a whole nother kettle of fish, which I've definitely had patients that I've gone, okay, we'll send you off for an MRI. They've got some radicular symptoms or radiating pain down their arm. Okay, I might be suspecting something going on with the brachial plexus nerves. Let's get an MRI just to have a look. And then it can unfortunately lead down a bit of a cascade of more further expensive care, because they've picked up on something else. There was something else on the imaging that they weren't too sure about. We've got to go get a CT scan. Okay, that looks a bit odd. Let's go get you a consultation with a surgeon. Let's go see this person. And then all these other referrals later to specialists and whatnot. It can just open up this whole can of worms that can leave the patient with no answers, with all this imaging, and God knows how much money later as well, because it's obviously very costly. And it can just leave them in a significantly worse situation than they were already in. Yeah. And that's a really hard part for me to deal with, because when people say, oh, what's the harm in getting an X-ray or getting an MRI, they don't think about these potential risks of it, because statistically you are more likely to go on to have further surgery or more imaging, it's going to be more costly for you down the track if you get a scan to start with.
That's very interesting. Do you think most people, when they get imaging, particularly of the spine, they can see that they have some degeneration around the disc or things like that? Like, I feel like a lot of people get really alarmed with that, even though they might not have any symptoms or pain or anything, right?
Yeah.
And do we all have, or most of us have, some type of degeneration? Should we be worried about it?
Yeah, exactly. Yeah, very common concern for people because they don't really understand the context of what degeneration is. It's that everyone will get degeneration. That's just a fact. Like, that's just our bodies over time. We don't heal as quickly. Just living a life, you'll get degeneration of the bones, the joints, the ligaments. All these things start to break down over time, and that's a completely natural thing. But there's not necessarily a clear correlation between the amount of degeneration you have and the pain that you feel. It does increase the likelihood that you might have pain over time, and there's lots of other factors that kind of go into that. But just because you've got degeneration doesn't mean you're going to have pain. It's not a clear link. So that's why you have patients that will have a lot of degeneration on their X-ray or on their scans, and they don't really feel a lot of pain, and it doesn't really make sense to them. Or vice versa, they've got nothing on their scan, and they're like, "Oh, I've got all this pain. There must be something else there." And then that kind of leads into they've got this result, so like, "Oh, my scan showed all this degeneration on my spine. That means I can't do all this exercise now, or I'm going to make it worse if I continue to do that." You see that a lot with patients with like knee osteoarthritis. So degeneration of the knee, I can't run anymore. I can't lift weights anymore. I can't do this, I can't do that.
Yeah.
Just because they've seen that. They probably had no issues with it to start with. Like, it was pretty normal. Like, over time, you're going to get degeneration in your knee. Maybe you've had some injuries in the past. But it's not until they got the scan, they've seen this degeneration, they're like, "Oh, I can't do anything anymore." Like, it's not that clear.
I've definitely seen that before.
Yeah.
And then it creates some limiting beliefs on like, there's nothing I can do about that.
Yeah.
Even if I recreate some better strength balance around the knee, which is often one of the big ways to help people with their knee pain. They're like, "Oh, no, like I got, look at this paper says this here, degeneration and that, inflammation here and big words that most of the time they don't quite understand. And if I had a scan on my healthy knee, they would probably say similar things.
Part of that is the explanation or lack of explanation that they've been given from whoever's got the imaging or whoever's providing the scan. I think that really comes back to us as health professionals giving good, solid advice to the patients and explaining to them what these results mean in their context. Because if you're a patient looking at a report and you haven't actually talked through that with your practitioner, it's going to just look like a bunch of nonsense. Like, there's a lot of big words and they don't really understand what it means. It can read it can be quite scary just to read that and go like, what does all this stuff mean? And they don't understand how it's actually going to influence them. By having a clinician that can sit down, talk to you about your findings, explain them all in a reasonable way, and not in a way that's going to create fear and kind of create this overarching belief of you can't do things, you can't exercise, you can't do this, can't do that. That's the conversations that we need to be having. I think that's where a lot of that fear gets created, is because we're not explaining what these findings mean to the patient, because it's not their job to know all this stuff, it's our job, and we need to be able to communicate to them that in an effective way.
Yeah, and it goes back to finding a practitioner that you have a good connection with, because then the communication flows well.
Yeah, 100%.
Great. I think we went over a lot today.
I think we covered a fair bit.
Thank you for your time. Thank you for your knowledge. Where can people find you? You mentioned it at the beginning.
Yep.
But
so reach out on Instagram, Isaac the Chiro, or online. My practice where I work at is called DMC Health and Wellness. We're over in Chatswood, kind of borderline Chatswood, Willoughby. Booking online, or even just reach out to me on Instagram if you have any questions or anything like that. I'm more than happy to have a chat to patients before they even come and see me, because that's like we were talking about. If you want to get to know your clinician before you actually reach out and get an appointment with them, that's something I'm a big believer in. So I'm more than happy to take a phone call with someone, just kind of understand their beliefs or understand their concerns of what they're looking for and whether I might be able to help them, and then we can go through that process.
Nice.
But, yeah, Instagram or jump on the website.
Beautiful. Thanks, Isaac.
Thanks, mate.
I appreciate it.
Cheers, mate.